This is a summary of the CPIC guideline for non-steroidal anti-inflammatory drugs, abbreviated to NSAIDs, and variation in the gene CYP2C9. This video will specifically discuss the gene-drug pairs which were assigned a no recommendation in the guideline. Videos covering the recommendations for celecoxib, flurbiprofen, ibuprofen, lornoxicam, meloxicam, piroxicam, and tenoxicam can be found on the PharmGKB website and on the PharmGKB YouTube channel. This guideline was published in March 2020. CPIC assigns a no recommendation to a gene-drug pair when there is insufficient evidence, confidence, or agreement to provide a recommendation to guide clinical practice at the time of publication. Based on the evidence which was available when creating the guideline, a no recommendation was assigned to the following gene-drug pairs: aceclofenac and CYP2C9, aspirin and CYP2C9, diclofenac and CYP2C9, indomethacin and CYP2C9, lumeroxicam and CYP2C9, metamizole and CYP2C9, nabumetone and CYP2C9, naproxen and CYP2C9, diclofenac and CYP2C8, and ibuprofen and CYP2C8. CYP2C8 and CYP2C9 are enzymes involved in the metabolism of some NSAIDs, as shown in this image, which is adapted from the PharmGKB ibuprofen pharmacokinetics pathway. The available evidence for aceclofenac, aspirin, diclofenac, indomethacin, lumeroxicam, metamizole, nabumetone, or naproxen and CYP2C9 suggests that the pharmacokinetics of these drugs are not significantly affected by variation in CYP2C9 function. As such, there is insufficient evidence to provide a recommendation for these gene-drug pairs at this time. There is also insufficient evidence to provide any recommendations for diclofenac and CYP2C8 and ibuprofen and CYP2C8. This guideline has been annotated on the PharmGKB website. This includes a summary of the no recommendations and excerpts from the guideline. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.